ever suffered from symptoms of a UTI, urinary tract infection? You had the urgency, you had the burning, you went to the bathroom every 5 minutes, you went to the doctor, you got the antibiotics, and nothing happened, or your UTI went away for 5 minutes and then came right back as if nothing ever happened? If that's the case with you, then this video is for you. In this video, we're going to discuss those entities that walk like a UTI, talk like a UTI, sometimes make more like a UTI, but are actually not a UTI. Alright, so let's talk about this. So you've had urinary tract infection, you felt that burning, and right before you were about to pee, or constantly, if you felt an urgency to go to the bathroom very frequently, and you went to the bathroom every 5 seconds to pee or to urinate, and then you went to the doctor, you drank your cranberry juice, and nothing happened, meaning the UTI just persisted, and the doctor kept on giving you antibiotics, or you just went away for a while, you just gave up, decided it's not worth it, and decided you're going to try something natural, which again worked for a minute, and then your UTI came right back. What is happening here? Well, there are things, or there are entities or conditions that can feel like a UTI, and I'll explain in a moment why, but are not UTI, meaning they are not necessarily infectious. In fact, most of them are not infectious at all. And that begs the question, what can be done about those conditions? Well, let's talk about those conditions. So, a UTI, or the symptoms of a UTI, are caused by inflammation, meaning irritation of the external meatus, or the opening of the urethra, meaning where the pee comes out, or the urine comes out. Now, when that area becomes irritated by either an infectious process that elicits the immune response, or by other causes, then you're going to start feeling those very, very well-known and all too familiar symptoms of a UTI, meaning the urgency to go pee, meaning you just feel like you have to go pee right now, the burning when you pee or before you pee, just the constant nagging burning or pain or sometimes itch, and obviously going to the bathroom, actually beyond the urgency, actually going to the bathroom to pee in short little squirts, and everything is haywire. So, when those symptoms happen, most people gravitate towards the assumption that they're experiencing a UTI, or a urinary tract infection, where in fact, what they're experiencing across the board, whether it's infectious or not, is they're experiencing a urinary tract irritation, which means that the area is inflamed, but the cause for the inflammation can be either infectious or it could be other things. So infection is one cause. It's actually a very common cause, and most women experience at least one episode of a UTI in their lifetime, for which an antibiotic and maybe some cranberry juice is going to help. However, there are causes that irritate the external meatus and are not a UTI. So what could those be? Well, let's just go for the obvious ones that are actually an extension of a UTI. One of those causes could be an antibiotic-resistant bacteria. So that's actually pretty easy to figure out. What you would do is you would get a urine culture, you would grow the bacterium that has infected the urinary tract, you would determine its antibiotic sensitivity, and you would treat accordingly. So it may not be the reflexive antibiotic that you were given, it might be another antibiotic. Another cause, infectious cause, that could cause urinary tract infection are yeast. So yeast usually don't quite infect the urinary tract, they usually infect the vulva or the vagina. But they can actually, by either extending the infection itself into the external urinary tract, or they can actually cause widespread inflammation over the area. They can lead to symptoms that are very similar to a UTI. Now, yeast do not respond to antibiotics. Yeast actually would respond to anti-yeast medications. Again, you need to make that diagnosis. You can't just treat blindly, because anti-yeast medications do have their own set of side effects. And interestingly enough, some of those side effects may actually lead to irritation or an allergic reaction over the area, which could lead to more UTI symptoms. Again, these are not urinary tract infection symptoms, but urinary tract irritation or inflammation symptoms. Now, other causes that could lead to very similar symptoms are vulvitis, meaning irritation or inflammation of the vulva or the vagina itself. And that could actually spread out and extend over the entire area, involving the external meatus, which could lead to UTI symptoms. So you could be dealing with something that's completely non-infectious by means of having applied something to the area that got it all worked up, or had sex, or had any other physical abrasive element applied to the area that could have inflamed it, or sometimes the area becomes inflamed all by itself, or sometimes you're trying to disinfect the area with alcohol or with other antibacterials or antifungals, and that could lead again to either an irritant reaction or an allergic contact reaction that could lead to UTI symptoms, right? Another entity that can cause UTI symptoms is lichen sclerosis. I've actually spoken about lichen sclerosis at length at a recent video. Lichen sclerosis can inflame the entire area, including the meatus and the urethra itself, and can cause UTI-like symptoms. Other conditions that can cause very similar symptoms are lichen planus. That's another irritation or another inflammatory condition that affects the privates among other areas of the body, and that can also inflame the urethra and lead to UTI symptoms. Other conditions that can cause UTI-like symptoms are psoriasis of the area, seborrheic dermatitis can cause it, and then there are conditions that are a little bit less well known, like warts of the area that can actually infect or invade the external meatus and form growths over that can really lead to sort of this constant irritation of the area. And then there are tumors of the area that can actually grow over the external meatus and into the urethra and lead to symptoms that are very similar to UTI symptoms. Specifically, there are growths like lymphangioma circumscriptum, which is a form of a blood vessel or a lymph vessel growth that can infect the meatus and the inside of the urethra and can lead again to symptoms that are very similar to urinary tract infections. So what do you do with all these symptoms? What do you do with all those conditions? Well, first of all, you have to back away and do no harm. That's the most important thing as a first step. Do not try to blow towards the area, which a lot of people do when they come up with urinary tract infection-like symptoms. They actually try to use hot water, they try to use soap, detergents, cleansers, other disinfectants to get rid of the infection that they think they have. Unfortunately, all of these practices are going to further inflame and irritate the area. That could actually make your symptoms worse. It will not, by the way, none of these practices are going to treat your infection. An infection, if you do have one, whether it's bacterial or a yeast infection, must be treated with specific treatment, meaning with antibiotics or with antifungals or anti-yeast medications, which will specifically address those infectious organisms, get them out of the way, clear the road, and then the immune system will take care of the rest. If you have anything else, such as an inflammatory condition, specifically lichen sclerosis or lichen planus, or any other conditions like vulvitis, any other condition, you must address the root cause of the condition. So with the idiopathic inflammatory conditions like lichen sclerosis and lichen planus, you would treat with an anti-inflammatory directly. If you happen to experience a case of vulvitis, whether it's an irritant vulvitis due to an irritant that's being applied to the area, or an allergic contact vulvitis due to an allergen that's being applied to the area, you need to obviously withdraw those offending agents and then consult with a board-certified dermatologist to treat the area effectively, usually with a topical cortisone or another topical anti-inflammatory. In very severe cases, you may even need to go to systemic therapy, but that's at the discretion of your consulting doctor, and I suggest that you see one if you're experiencing those symptoms. That could save you a lot of time and heartache. If you're experiencing any conditions such as growths over the area, again, you need to consult a doctor who's going to make the diagnosis, who's actually going to astutely examine the area, make the assessment that something else is happening there besides the UTI that you're suspecting you have. Make the diagnosis through either an examination and or a biopsy or another test, and then refer it to a treating doctor that'll actually address the issue at hand. So these are very different approaches for very similarly feeling conditions, which are usually they have nothing in common. The only commonality that these conditions have a lot of the times is that they occur over the specific area, and that specific area is transmitting the same sensations because they all ultimately lead to irritation of the area. Well, I really hope you enjoyed this video, got something awesome and of value from it. If you did, please hit the like and subscribe button to support the work coming out of this channel. Again, thank you very much for watching, and God bless.
Ryan Little.